According to a latest study, scientists have estimated that 15% of deaths from COVID-19 across the globe has been attributed directly to prolonged exposure to air pollution. As much as it is a relief that in India the daily case count has significantly dropped, the fact of the matter is we can't let our guard down. Well, winter is fast approaching, pollution levels are rising. Experts say that this is the time COVID-19 situation can become severe. In a recent press briefing, the Indian Council of Medical Research, the ICMR, has very clearly stated that there has been studies proving long-term exposure to air pollution has been linked directly to an increased risk of dying from COVID-19. Dr. Balram Bhargava, the Director General of the ICMR, has said that there have been studies from Europe and the United States where they have looked at polluted areas and have compared mortality during lockdown and correlation with pollution levels. Now, it is found that pollution is contributing to mortality in COVID cases. And that's well established. As per the survey, it's an average of 15% of deaths worldwide that's been attributed to pollution levels, COVID-19 deaths. But when you go into specifics of Europe, the proportion was given at 19%. In North America, it was given at 17%. And in East Asia, about 27%. We also spoke to a pollution expert to give us a perspective and also tell us how important masks are now more than ever. At a time when pollution levels are rising and of course you're in the midst of a pandemic, how important is it to wear the right mask, and not just as a chin mask but as a proper face mask covering your nose. You can fight COVID-19 and also pollution. Jay, how important is it during the time of the pandemic as well as rising pollution levels for us to be wearing a face mask? As much as people preach, we seldom see public on ground, on field, really adhering to COVID protocols. So give us the importance of a face mask and how must is it that you cover your nose? You're also going to save yourself from pollution levels, would you say?
Yeah. So, I'm going to start out, Nabila, by saying that the face mask right now is more important than vaccine, because the face mask is the only preventative, it's the only way to protect yourself from, both COVID and air pollution. Clearly, air pollution is entirely, exposure through the air, and even COVID, whatever we know so far, we know that 85 to 90% or maybe even higher, the transmission is all through the air. Okay.
Right.
So the face mask is only important. I already kind of spoke about the fact that there are lots of masks out there with false claims and fake certifications.
Right.
They're fakes or they make false claims. So, look at the certifications, use your judgment. I'm going to ask you the question, would you take a vaccine without kind of getting deep into the details of it? The mask is the same way. It is a high involvement decision. Your life could depend on it. Now, in terms of, what to do with a face mask, you got to cover your entire face. A good face mask will have a nose band. You got to press it down. I'm going to, it has to seal your entire face. And I'm going to just breathe in an exaggerated manner. If your mask is doing that, it's a good fit, you are secure, and your mask is going to help you. If you wear your mask over your nose, on the bridge of your nose, no matter how exaggerately you breathe your air pass, your air is going to follow the path of least resistance, and it's going to enter through all your openings. And you're exposed. You're exposed to air pollution and you're exposed to COVID.
How pollution levels attract COVID all the more. COVID mortality rate increases with the rise in pollution levels. That's what the ICMR has said. What's your opinion on that as a champion for the cause?
From Lahore to Dhaka, this time of the year for about 4 months. So we're not even talking about short-term exposure. We're talking about long-term exposure. We're talking about the most densely populated. The Indo-Gangetic Plain is the most densely populated place on the planet. About 700 million people, about 10% of the global population lives here. And we're about to undergo the first experiment of its kind with COVID and air pollution. And God help you if you have, a pre-existing condition, because then it's not a double whammy. Then it's not a twin-demic, then it's like a triple-demic. I don't know. We're just coining new words every day.
Well, the bottom line is the lesser your exposure to air pollution, the safer you are from COVID-19 complications.